Hi, my name is Rich. I am the founder of Medical Referral Hub. Thank you for joining us today on this video. With me today is an awesome physical therapist out of the Colorado Springs, Colorado area. His name is Joshua Lee, and Joshua Lee has 14 years of healthcare experience. And today he's just going to share a little bit about his journey and try to teach us some stuff about rehab. Josh, how you doing, sir?
Hey, I'm doing great, Rich. It's good to be here.
That's awesome. Thank you so much for taking time out of your weekend to visit with me. I really appreciate it. And I know that the viewers will appreciate it too.
Awesome. I'm happy to be here.
All right. Hey, Josh, let's kick it off with what really led you to the field of rehab?
I originally really wasn't interested in healthcare at all, or rehab or physical therapy. So I'm a physical therapist, and when I was a youngster growing up, my dad was a history teacher. My mom was an RN working in the local hospital nearby, and the most exposure I had to healthcare or even anywhere near rehab type settings was visiting my mom sometimes after school, or just getting taken up there to say hi to her when she was at work. And just hearing the nurses tell stories that sometimes they'd gross me out, or just things that I was not interested at all. But down the road, whenever I was trying to choose a major during college, my mother was able to get me connected to a physical therapist that I could do an internship with. And getting to follow that physical therapist, his name was Steve Spivey. It was an acute care traditional hospital, and just getting to see how much fun he had every day, how much he loved to focus on teamwork, working with the nurses, the doctors, the respiratory therapists, all the other staff, and the connections he made with patients.
Absolutely.
Was really what got me inspired to I think I do want to go down this road of physical therapy. He told me a story too about how, if you're a doctor, you may have to, round on a high volume of patients, and you may not have more than maybe 5-10 minutes at a time with a patient. But as a physical therapist, you may have 30-45 minutes or even an hour to connect with that person and really dive deep and help the patient. And so that's really what it was. And that's how I got down that path, and then went from there.
That's awesome, man. Well, we recently met with a physiatrist who let us know that PMR physicians are actually like the contractor at a building site, and they just put everything together. They connect everyone, and they make sure that everything's working properly. And he likened that to the continuum that the patients will go through when they're in one setting. All the doctors have to meet, and it's really up to that PMR to put the pieces together for that patient's recovery. So I think that's absolutely fantastic.
Yeah, that's a good point, because really what I like about physical therapy is that teamwork with the physicians, kind of getting in there and getting up to date on the medical situation, the challenges that the patient is facing that way, and then being one piece of the solution, and kind of collaborating with what the medical treatment plan is. It's a lot of fun.
That's great, man. So where are you now with your physical therapy career? Like, what are you doing now?
So what I'm doing right now is I work for an LTAC hospital, a long-term acute care company that this setting is for patients that are going to need prolonged hospitalization. Potentially they're on a ventilator, maybe they have IV antibiotics for a long time that they're going to need to complete. A lot of other things. There's a whole list, but I work in the admissions department there. So mostly my job is to meet families, patients, and kind of explain what this kind of a hospital is, and also to network with the case managers, the doctors within the hospitals where the patients are, and kind of collaborate with them to figure out if long-term acute care hospitalization is the best next option. So that's pretty much it.
So you're a really important part of the education for when a patient is going to transfer or even just, you could probably answer general questions that a patient has the moment you walk into the room.
For sure. Yeah. I really love taking my physical therapy background, as a physical therapist. I work mostly in ICUs and with patients that were in critical condition. So I'm used to being in that setting. And my favorite thing to do is just to try to boil that down and make it help a person feel encouraged and at peace with what's going on and understand, where they are in the hospital, what's going on, why it's happening, and kind of what next steps make sense.
Awesome, man. That's awesome. So moving on, what are the biggest challenges that physical therapy patients are going to face while they're at the hospital?
That's a great question. So, what I've noticed, working in hospitals with patients during physical therapy sessions, for one thing, you never learn about how hospitals work and this concept of the healthcare continuum and all these different resources that are out there. We never have a class on that in school, at least not that I'm aware of. And then not to mention that, and on top of that, you're in the hospital sick. You don't feel at your best, and there's all this information being thrown at you that you've never been exposed to before. And it can be pretty overwhelming. I have seen patients just get frustrated with the situation, or just have a lot of anxiety because they don't know what to decide on next, what to choose next, because they've never had to choose it before.
Yep.
And so I feel like that's a big challenge for the whole healthcare system. Like we were talking about earlier, there's a lot of people in the hospital these days, especially during coming off the COVID situation. The hospitals are full. They're trying to take care of a large number of people, and for them to, I just don't see it happen that consistently, that people that are in the hospital are able to learn about all these options and get a really in-depth kind of understanding that helps it make sense and not feel overwhelming.
It's probably, honestly, the last thing they want to hear about is another level of care or the next destination, when they haven't even fully understood why they are where they are now or what services are going to be available to them while they're there. So I got to know, what's a big challenge for physical therapy patients after they leave a hospital?
Sure. Yeah, I mean, I heard it put one way that was really helpful, that there's 7 levels of healthcare. The hospitals are just one of those levels. And there's inpatient rehab facilities, there's skilled nursing facilities, there's home health agencies, outpatient services, palliative and hospice. And there's all these different levels. And depending on what's going on when you're at the hospital level, determines, what you should consider as your next step through that, out of all those 7 options. And so that's another thing is that a lot of times we'll see patients that are saying, I'm just now getting comfortable where I'm at. I finally understand what's going on. And now I have to leave all these people I've built trust with and that I understand a little bit about what they do. And I have to go to some other facility or a different setting. And so that has been a big challenge that I've seen for families of patients or patients themselves, where we just have to walk through all those levels and talk about how their insurance impacts what they can access and what they can't access, and how their medical condition kind of limits or opens up possibilities as well. So
wait, Josh, are you telling me that all insurances aren't created equally? That would be a new concept to me.
Yeah, that's in my current position. That is something that before, as a physical therapist, I just focused on the patient. I didn't care what insurance they had. I was going to give them the best care I possibly could, right? Exercise, functional independence, getting people home. That's my focus. When I got into working in admissions, the insurance becomes pivotal to understanding what things you have access to through that insurance. And a lot of times that's a big barrier, or it can be a thing where it actually because of the insurance you have, hey, you're lucky you get to actually access, this other level of care.
Mhm.
And so, yeah, that's if only all the insurances had kind of basically the same
Yeah, that
type.
would be so nice, wouldn't it? That would be amazing. Hey, that's a different video for a different day. We'll definitely touch on that in the future. Um, but what are your recommendations for how patients can get the most out of their hospital and post-hospital experience?
I'm glad you asked that. I mean, that's a great question, because I mean, what I've noticed as a physical therapist, I mean, the big idea is basically putting yourself in the driver's seat of your healthcare, instead of looking at yourself as a passive recipient of healthcare that's just kind of like, maybe picture yourself on like a boat floating down a river, and healthcare is just carrying you along, and maybe you don't have a paddle and you're just kind of going with the flow, right?
Mhm.
Like, instead of that, imagining that you strap a motor on that boat, and you start taking control of where you're going and steering. That's the big idea that I would recommend to folks, is if you can take the mindset that, hey, if you have insurance that's paying for this healthcare, you're the employer now.
Yeah.
And in every single person that walks into your hospital room, or who comes to your house, if it's home health, or if you go into their clinic as an outpatient, all of those people work for you. And that's what I always told my patients is, I work for you. And I would say that, as a lighthearted thing, but it also helped me remember that I work for my patient. They're the one that I'm trying to serve. Their priorities are what matter. And so if you're the patient, that's the biggest thing you can do, is to decide, I'm going to drive this ship. What are my goals as a patient? Where do I want to be? And now I'm going to learn everything I can. And so, I mean, if I broke that down, I would give it a couple of different pieces. I mean, the biggest thing is preparation. So one of the things you can do if you're going to end up needing physical therapy is to be able to give that physical therapist high quality information about your normal life before, your typical routines, your capabilities, your independence levels. If I walked into a person's room and they had just had a stroke, part of my evaluation was to find out, before you had this stroke, did you play tennis? Did you play golf? Like, did you do a lot of stairs? Did you go running? Like, what were your routines? Did you ever fall before this injury? Did you have really great balance? All those kind of questions. Not that you should have to, type up a 20-page paper about what you can do now, but if you ever are gonna be in the hospital, if you have just a brief summary of, this is the square footage of my house, this is how many levels it has, this is how often I exercise.
Are those really things that physical therapists, do in the therapy gyms? Like, do they practice going upstairs and moving things around, like plates and stuff?
Oh yeah, that's a great point. I mean, yeah, that's really what a physical therapist is supposed to do, especially in the hospital setting. I mean, when you get to like outpatient or home health, there might be a more nuance to that, maybe a higher level of difficulty, but especially in the hospital, like after a stroke, it's all about function. It's all about helping you as the patient that's had an injury regain your independence, regain your ability to do the things you love to do. So, I mean, if a patient told me, like, I just want to be able to hold my grandkids again and not have to worry about dropping them or losing my balance or getting out of breath, but before I get done playing with my grandkids, that was always a huge thing of like, okay, let's make everything that we're doing in this therapy session about that. So we're going to do things that actually mimic picking up a grandkid, and have you keep your balance while you're holding a weight, or something like that, where whatever we could do to kind of what we like to do, we like to customize it. It needs to be specifically serve this person that I'm helping. So
Awesome.
that's the kind of stuff we kind of go off. So preparation is key. I mean, the more the physical therapist has access to those prior levels of function, the better they can customize.
And sorry to cut you off, but if someone maybe was jotting that down on a monthly basis, and they ended up bringing that in, or they had a family member bring that in whenever they experienced a fall and were hospitalized, you could literally just go through that notebook or that sheet of paper and know what they were able to do before they were injured.
Perfect. Exactly. Yeah, that would be so helpful because yeah, sometimes if your injury is such that you can't speak very well, you're too tired to speak, or you know there was any problems where I couldn't access from you, but your family could bring that information in. That's going to be huge.
Wow. Okay.
Yeah. I mean, so that's preparation, is just not getting an idea of your normal. The second one is just intentionality, and then a third, ownership. So like that's kind of a mindset thing. It's not as much of a tactic of something you would do, but when you are in a physical therapy session, if you don't feel like the physical therapist is helping you achieve your goals, or you don't know why are they recommending this exercise, whenever I told them I want to be able to play golf again, but why am I on this machine? You know, that's a great question, and you should feel the freedom and the power to ask that question of your physical therapist, and they'll actually appreciate it because it gives them a chance to, you know, really connect the dots. And that, because a physical therapist is really like is a teacher and a coach, and so the intentionality of I want my goals to be accomplished through this session, and the ownership of I'm the one that has to make sure that this works, and if this physical therapist is not helping me achieve my goals, I need to have a frank discussion about it. Because I think as a physical therapist, I always appreciated it if a patient was really not getting it, and they felt the freedom to basically say, Josh, you know, I don't understand why are you having me do this?
Yep.
And that was a really great opportunity. So be prepared ahead of time, but once you get there, you're the boss. You're driving the ship. Be intentional. Ask as many questions as you can to understand, and see yourself as the owner of the experience. Don't ever feel like the victim. Don't ever feel like you're just floating along and just having to do whatever these experts say, because all these experts work for you.
Or that you're an inconvenience. I've seen a lot of patients feel like they're inconveniencing physicians or staff members or anything. No, it goes back to what you said in the beginning of this video. We're providing a service to the patients. So it's important for the patients to speak up if they feel like the service is poor.
For sure. Yeah, okay. That's huge. I'm glad you brought that up. It's really important. I mean, the only other things I can think of, if you're in the hospital and you're wanting to get the most out of it, is just viewing the people that are working for you, the different healthcare staff that are coming in your room, whether it's, even if it's like the housekeeper or the dietary person that's bringing you your meal. Every single person's part of your team, and when you view it that way, if you're the team leader, you have to give the vision. You have to kind of give feedback and give that advice as to how to work together. And so communication becomes key to that teamwork. And like you said, being willing to speak up, and also feeling a responsibility to make things clear, and help people know that you appreciate them too. Because I think a lot of times that they were meaningful to me as a physical therapist was just to know if it really felt like to this patient that I was helping them, if they felt like they were being helped, that helped me know, okay, cool, I'm doing the right thing. I'm going to do more of that. Yep. So if you're thinking, man, I like this experience I just had, tell people about it, because the more you say, hey, when y'all did this with me, that helped me and it made me feel so much better. When you tell people that, you're going to get more of that coming to you, and it's going to make your experience even better. It's going to ramp it up. And then the last thing is really just hard work. Healthcare isn't just a medicine you can just swallow it and just get the benefit without doing anything. It's a lot of hard work. And if you go into the hospital with that mindset that I need to work hard at learning, there's going to be a ton to learn. I need to work hard at changing my routines to take in the new information and use it. So like an example of this is like, I worked with a lot of patients that had congestive heart failure, where they had to learn new ways of dealing with salt in their diet and fluid and taking their pills on schedule. And so what I would do in my therapy sessions is teach people about how congestive heart failure works, where it's harder for your heart to push the fluid around, and when you add extra salt to your diet, you have extra fluid in your system that's even harder for your heart to deal with. And so it becomes a problem. You get too much fluid in your body, it can become so bad that you can't breathe very well. And so I had to teach patients how they could self-manage at home and kind of measure how short of breath they were getting with normal, certain typical activities, like say, just walking from the bed to the restroom in the morning. How short of breath did you get? And then rate that shortness of breath on a scale and kind of track that at home. So that wasn't anybody's favorite, to be told, eat less salt, measure how short of breath you get every day. And then you can tell if your shortness of breath is jumping way up, hey, there might be something wrong here. I better call my doctor. And so that kind of stuff, that's hard work. Changing your lifestyle around a new medical diagnosis like congestive heart failure or any other diagnosis where it requires you to change your lifestyle, that's a lot of hard work as well. And then not to mention the exercises to get back in shape after you've been injured or sick. It's just plain hard work. So if you go into it with that mindset, though, you won't be thrown off whenever they say, okay, we've got to go on another walk. When the physical therapist comes in to bug you, and you just got relaxed in your hospital bed, and here comes a physical therapist bugging you again. That being said, I always was trying to work around the patient's schedule and make sure that if someone was tired, we could schedule it where it would work out. But that's another thing where I just needed the patient to kind of tell me, hey, this isn't a good time for me. Is there any way you could circle back in 30 minutes or something like that?
Instead of just declining the PT for the entire day, just try to come back a little bit later.
For sure. Yep.
Awesome, man. This is great information. So tell me, what resources do you recommend that people check out when seeking to learn about their healthcare and rehab options in particular?
For sure. So definitely would say, the top thing in the very beginning is if you have a physician, like a primary care physician, or if you're talking about in the hospital, the physicians that are managing your care in the hospital, is whenever you are speaking with them, to have a lot of questions prepared in advance to ask them. Everything you don't understand about healthcare, when they come in your room, that's your chance. Jump on it. And have your questions written out. Because what's always been hard for me is if I go to my doctor's visit and I haven't pre-considered what I want to ask about, what my goals are, the doctor will come in, do their assessment, come up with their conclusion and what they think you should do, and they're getting ready to go to their next patient. And they're like, "Is everything good? You have any questions?" And sometimes it can feel like, man, I better have a question. I better think of something quick. I only got like 5 seconds to think of a question. But if it's like, you whip out here's my questions, while it's your visit, it's your visit. And not to be rude to doctors or anything. I think that most doctors that I've ever brought out my questions, they've been more than willing, like, oh, somebody who wants to learn, somebody who wants to, be helped. And most of the time, any questions I've asked, every doctor has been more than willing to help me out. So that's one key way, is just to get the most out of your doctor visits. Another thing is to think of a physical therapist as another direct resource you have in the community. A lot of the states these days have moved to what's called direct access. And so you don't have to, as before direct access came, the only way you could go see a physical therapist and have your insurance pay for it was for a doctor to write a script, for you to be able to go take that order that says get physical therapy or occupational therapy or what have you. But now with direct access, what's really cool is that you can just go directly to the physical therapist of your choice, which is if you're paying out of pocket, that's you could go to anyone and wouldn't have to worry about an insurance network. But if you have an insurance, you just check that they take your insurance just like you would with any like a physician.
Very cool.
And so you can use a physical therapist that way. But what I'm really excited too is about the MedRef hub that you're working on, Rich.
Mhm.
Like, I feel like this is an amazing resource that not only can you check out all the different levels of care in your community, but these videos you're making and these educational resources that you're putting together with that just is kind of a all-in-one resource for kind of studying what's at your fingertips. And so I just think as your platform develops, Rich, this is going to be an awesome place for anybody that is needing to make some decisions to go check out.
I appreciate that, Josh, man. That's awesome. That's awesome. Thank you, Joshua Lee, for meeting with us today. Medical Referral Hub is very, very happy to have you as a contributor. And I just want to say thank you also to your wife, Rebecca. You guys have been married 10 years and you parent 6 children, ranging from 9 years to 6 months old. I think that's fantastic. And we hope that they're able to continue supporting you while you care for the community out there in Colorado Springs.
Thanks, Rich. I appreciate it. It was a pleasure to be here.
Absolutely. Have a great day, Joshua Lee, and we hope to talk to you soon.
Take care.